And we are side by side looking at both the Oh My God packet and the medication categories opened up to antihypertensives. Now, I want to show you something, and they're not always easy to find, so when you find them, get them. These are colored note cards. Now, as you may or may not know, by Sunday, someone in this class wins everything, right? They win a free class if they need it. They win a self-study, all of these packets, every single one of them. They win the note cards, the notebook, the pens, the markers, all this shit. We give it away, right? So somebody gets lucky. I'm gonna pass around a card that is exactly like your flashcard is instructed to be made. So when you buy your flashcards, make sure that you have the ones with lines on them. I prefer the color-coded ones because you can separate the categories. So maybe you make all your beta blockers blue. You make all your calcium channel blockers yellow. You make all your steroids or whatever, you know. You got your little cards. Now on this card, I put the categories, so you guys gotta know, it's better to learn the medications by the categories. And on this card, I put the beta blockers. On the back of the card, I put everything important for you to know, which is what does it treat? What should the nurse do before she gives it? What are some contraindications? You know, how does it actually work? And then the two most popular medications on there. So when we get done today going through your two packets, your Oh My God packet and your medication categories, you'll know exactly what to put on the back of these cards because I point out the biggest highlights of all. Now, I love it. Somebody said, well, don't they have them where they're already made? Sure, but you ain't learning shit. In other words, when you make them, you learn them, period, end of story. And going to Ursuline College taught me that. They said part of your learning is the note taking. That's why you're taking notes on rationales and things like that. I'm gonna pass this around. I want you to take a picture of it so that you know exactly how it should be done, okay? So I'm gonna pass this around on this side. It should make it back around on that side before it's all over with. And then the note cards or whatever will be for Sunday. Somebody will win a ton of those. All right, and we do the same thing. Now listen, there's only two things that we make note cards from. We make flashcards for pharmacology, and we make flashcards for infectious diseases. So when we talk about infectious diseases, I'll come around and you'll see the note card for that. I think I have one laying around here called impetigo. So a good example of that. This infectious disease is called impetigo. And so impetigo, if you look on the back of my card, the first thing that should go on the back of it is what type of precautions. So on the back of the card is what kind of precautions, what kind of PPE to put on, what is it caused by, some specifics to know that it's that and nothing else. So on my card, I have gowns, gloves, dedicated equipment caused by group A strep, honey color crusted pustules. And then I have the complications, rheumatic fever, and glomerulonephritis, no vaccine. So that's an example of how it should look. When we do our infectious diseases, I'll come around and show you. I'll pass it around for you to take a picture of as well. But there's only two things you can do that with. Again, infectious diseases and medications. The reason for that is those are the two easiest categories to learn if you do your flashcards. You just flashing through them. Remember, your kids can help you. They can hold the card and you read off of it in terms of what should be on the back of it, and they check and see if you read it. They absolutely adore when they can help you pass a test. Your significant other, whoever wants to help you. Studying is best done with two friends. If you have three, that's decent, but four is too many. Y'all ain't gonna do nothing but play. I used to have this one group in my class, and they did get through the class together. They all passed together, went to work together, and everything else. But the only thing was they studying took extra long because they was doing shots. And I'm just saying, if you bring shots to your study group, that might be a problem. You might be here a while. But they was doing shots for every right. I'm like, what? Oh my God, every right answer. I can't. Okay, so that's the deal. Now, so, oh, that's crazy. It's just crazy. Oh, that's Ari. Ari. Oh, now we know so much more about Ari. Yes, she actually runs the plasma donation clinic, one of the people that was in that study group. They were the ones that came up with the respiratory distress song because they were high. Yes, you sing all kind of shit when you're high. Okay, so now you are on, like I said, page 16. And you see the first thing that it says is anti-hypertensives can cause dizziness, always rise slowly and check the pulse with beta blockers, and who else? Calcium channel blockers. That is one that most don't know. It's not just the beta blockers that you have to check the pulse with. It's also your calcium channel blockers. And the last part of that sentence says non-compliance is the what? Number one cause of a crisis. Now, if you can, go with me to your medication categories. And essentially everything I said is there. So if you look at there, we do have the endings to it, but then above it is what you should be doing with antihypertensives in general. This is so important. Listen to me, no matter what kind of antihypertensive it is, whether it's a beta blocker, calcium channel blocker, ACE inhibitor, or an ARBs, or a diuretic, or whatever kind of medicine it is. If it lowers your blood pressure, you see right here in the medication categories packet that the patient needs to rise slowly. I have a father who's on this hot mess. I won't let him jump up and do nothing. So when I took him on the cruise ship, the dialysis cruise ship, I told them, I said, if he gets up, he's got to dangle first because that blood pressure be doing all kind of crazy stuff. And dialysis makes it worse. So teach them to rise slowly. Also to dangle. If that's not already there, add it to dangle. What is dangling? Let me not assume.
Your feet on the side of the bed.
Yep, you are swinging your feet, doing the toes to the nose and back to the floor while you're sitting on the edge of the bed. What is that going to do anyway?
Create blood flow.
It does. It gets the blood circulating all the way up to where? Your head. Your head, actually. Blood flow to the brain. Because you're going to be dizzy. Yeah, you would be lightheaded. Back to the heart. All of that is important. So teach them to rise slowly. It can be a reason for falls. Here's what I've noticed, because I had to do it with my dad. If someone's on antihypertensives and they're having more and more falls, and they tell you, I was dizzy when I got up, I felt lightheaded. Our society, number one, is kind of fucked up because they throw pills at everybody. Now, you done threw all these pills at everybody to the tune of 3 and 4 blood pressure pills, which they might need or they're going to stroke out, depending on the person. But then you forgot to reassess whether they still need them, and now they're 88. They probably don't. Number one, they're frail. They're not big belly, huge, obese like they were at 40. They've lost a lot of weight over the years. They don't eat the huge portion sizes and crazy shit you did at 40 and 50. They're probably only eating once or twice a day. Most older people are more on the dehydrated rather than the overhydrated side. And they don't need no damn 4 blood pressure pills. But no one ever reassesses. So for my dad, we got him down to 1. Get rid of this shit. You're falling, you're like blanking out in dialysis. Dialysis is going to make you hypotensive. Get rid of this shit. And so when we went to the doctor, we said, get rid of that shit, okay? The blood pressure was beautiful. Obviously, we check it every day. Don't advise that for your family, your patients. That's me. I'm a provider. Don't ever forget that. I'm not your typical nurse, okay? So you have to still coordinate this action with an actual doctor or nurse practitioner, because if you get off of it and you needed it, what will it cause? What will that cause? What did we just say? Hypertensive crisis. So you can't just willy-nilly go off of the meds. You really do have to have a provider on top of this, okay? But I'm telling you, when the falls get to be more frequent, it's probably because they're on too many meds. Now, this beta blocker, you already know it ends in OLOL, just common sense. I ain't got to tell you that. Why is it contraindicated in asthma or COPD patients? Why is that? What will it do? What can it cause if you give it to COPD or asthma patients? What's a risk of getting a beta blocker to that patient? It says it right on here. It's bronchospasms. If you look under number 2, I believe. Is it under number 2, you guys? Yeah, under number 2, yeah. Number 2, it tells you that bronchospasms and shortness of breath. It may also do what for the diabetic? How does it mask hypoglycemia? Let me see who knows their physiological adaptation. How does it cover up if your blood sugar is low?
Because it can't show the symptoms, like how he's sweating.
Exactly. So let's make sure we write this down next to our beta blocker medicine. It blocks the stress response. That's what you got to know. It blocks the stress response. That's what beta blockers do. They block the stress response. So let's think about this. What is the stress response? When you get stressed, what do? Sweat. Isn't that a sign of hypoglycemia? Now it blocked it. So now it's no longer a sign. What else do you do when you shake? You can shake. It's blocking it. What else can you do? But this is hypoglycemia, right? So what else does it do?
Anxious.
Well, if it's blocking it, it's making you more calm. What happens to the patient with low blood sugar? They're not calm. They're irritable, right? The irritability is a sign. You got one more, and it has to do with vital signs. What happens when you get worked up? You get tachycardic. So does low blood sugar patients. It's blocking it. It just said it makes you have a bradycardia. So every sign and symptom you could have when your blood sugar is low, the beta blocker blocks it. So I won't know, nor will you know, that your blood pressure is through the toilet and low. You won't ever know. Now that's horrible, because if you fall asleep, you're dead. Remember, low blood sugar kills you faster than high blood sugar all damn day. So if you fall asleep, which you might, because low blood sugar makes you drowsy, you ain't waking up. Okay, so you gotta know that. You gotta know that beta blockers can mask hypoglycemia. So you have contraindicated and significant lung disease. You have not a great idea, especially in real serious diabetics, because of the hypoglycemia. Now you see where you have a patient that maybe their pulse is less than 60. If you look under number 5, under beta blockers, their pulse might be less than 60. I need you to know something that you may not know, and that is every single time I work, every time, without exception, every time I work on a med-surg unit, which I still do to keep my skills up for you, I have to hold somebody's beta blocker for this reason. It's all the time. It is not like a random person every blue moon in your career. Oh, hell no. Every time you work, you're going to see this, because they've been on these beta blockers for a minute. They've been at their house not being monitored forever. Now they're in your hospital for something maybe unrelated, and now you're giving them their beta blocker as ordered, and you're like, well, damn, I done had you for the whole weekend, and neither one of these days did you qualify for this shit because your pulse is literally in the 50s. Now, they're fine. They're walking around doing whatever, never had a symptom. But in this situation, you've got to notify somebody that this person has not needed this beta blocker in terms of blood pressure. And had I given it to them, not only would their blood pressure drop lower, but their pulse is going to go lower. And that is going to be a nightmare, okay? So remember that the beta blocker drops the pulse like crazy. Here's how you got to look at it. Look at what it treats under number 3. It can be used with patients who just had a heart attack. It can be used for patients who have chest pain called angina. It can be used for congestive heart failure to keep them from being tachycardic. It can be used, believe it or not, for migraines because it blocks the stress response and, don't forget, it vasodilates. And test anxiety. Now, test anxiety, highlight that one, because maybe your little behind need it. Now, if you needed it, which one would you take for test anxiety? Propranolol. The problem with that is, what if you got low blood pressure, ain't never been high, all up in the low 100s and maybe high 90s, and you took propranolol for a test? You gonna fall the fuck out. Now, I had a student, y'all just be doing too damn much. She got her big mama's propranolol. Yeah. And she took the damn pill, and shout out to Jessica Doss. She took the damn pill, and then she sat there and thought, this shit ain't working. I'm gonna take another one. It's not good. So she said by the time the damn test prompted her to take a 2-hour break, she couldn't get up because she was so dizzy. So she was like, they watching me. So she already paranoid. This is how this retarded ass got up. Let me see. She said she felt like a robot with her goofy ass. So she's sitting down there knowing that they watching her, and she's like, she did that for a little while. She got up like this for a little while. And she was like, oh my God, for a little while. She held on tight to the table, and then she said it went like this. And the lady said, what is wrong with you? I don't know. I'm just really tired. Can you just walk me to the bed? Sure. I mean, please don't let your propranolol get your ass whooped at the testing center. Please. Don't do it. Don't do it, no. She was dizzy as hell. Now, she passed. But it took all them questions for her to sit through there and just fairly, rarely, really, barely pass. Woo, child. She passed, though. Pray for her. Now, she's one of the best nurses I know, but she was a fool. She didn't think the shit worked. I was like, okay, Jess. Now, so you got it. You got it. You got it. It can give you a little symptoms now. You talking about you taking some propranolol. Make sure your blood pressure can tolerate that shit. Otherwise, you're going to be like Jess. Now, when you look at the different medications that you see, remember that the first med is the generic name. So you see your metoprolol, propranolol, carvedilol, atenolol, timolol. Timolol you may or may not know, and it is a popular one on the test. Please highlight that that's eye drops. Please highlight that that's your eye drops. There is one that does not end in OLOL, and it is a very big deal because it's the exact medication that I use with my pregnant patients who are on contraindicated medications. Because remember, everyone, ACE inhibitors are contraindicated in pregnancy. They can't take that. They can't take diuretics either. They can't take half the shit y'all take. So when I get a pregnant lady with pre-existing hypertension, all I really can give her is methyl-dopa. So that's your Aldamet. Okay, that's similar to the beta blocker. We put it in that category because it's very much like it. Now, if you look at your